Howdy y'all! Today we're going to be talking about the 4 different types of top surgery, what top surgery is, the cost of it, and what to expect. Top surgery is a type of gender-conforming surgery that FTM and non-binary individuals use to masculinize their chests. The first and most common type of top surgery is double incision top surgery, or a mastectomy. 2 horizontal lines are cut, the breast tissue is removed, and then the areola is cut and skin grafted into a different size that better fits your chest. The cons of this is that you lose feeling in your areola, and that you have rather large scar incisions on your chest. The second is the inverted T or T-anchor top surgery, which, much like the before, is best for medium to large breast sizes. The only difference between this one and the double incision is that there is an extra incision that runs from your horizontal double incision up to your areola, where it is not severed and you keep your nerve endings, which is a big pro for some people who want to keep feeling in their areola. The third type of top surgery is periareolar top surgery, or periareolar concentric circle surgery. It's ideal for those who are small-chested, and I believe they only go up to a B-size cup, and that also depends on your skin's elasticity. The breast tissue is removed using liposuction through 2 concentric circular incisions. The edges of these outer incisions are sutured to the edges of the inner incisions, and the nipple stalk and nerve are left intact. Keyhole top surgery is the least invasive, but usually done on the smallest of chests. It is where breast tissue is removed through liposuction using 1 small incision at the base of the areola, where the nipple stalk and nerve are left intact, and sometimes it may include a nipple reduction, but that really depends on your nipple and areola size. Now, if you've been looking into top surgery at all, you'll know of something called a Pratt drain, which is just a medical device that draws out fluid that collects under your incisions after your surgery and stops something called seromas from forming under the skin. Seromas are just fluid collections. Seromas are just Seromas are fluid collections, and small seromas are treated through your body just naturally taking the time to process them, and larger ones require a doctor's office, numbing skin, and drawing out the fluid. So we really want those. It's another reason that we wear chest compressions, because seromas can be uncomfortable, tight, and delay the disappearance of swelling, which is something we really want because we don't want to be wearing these drains for a long period of time. Using compressions and drains prevents seromas. Now, a lot of people are afraid of their drains, but there's no reason to be afraid of them. You wear them for about 7 days. They go in between your incisions, and it doesn't really hurt. The placement of them is meant to not hurt. And if it does hurt, you should probably talk to your doctor. Sometimes there will be slight area rubbing where your chest compression and your tubing connect. But besides that, drainage tubes aren't that big of a deal and aren't something to be afraid of. Another question that's often asked is, how much does top surgery cost without insurance? Because sometimes our insurance doesn't cover things, and even if it does, we don't know how much it'll cover. So top surgery usually ranges from, at the lowest, $3,000 and at the highest, $10,000. Cost is something you can talk to your surgeon. Cost is something you can talk to your surgeon about, as every surgeon is different. My top surgery, personally, I think cost about $7,000 or $8,000 without insurance. Insurance did not cover any of my surgery. Something else to note that is very, very important if you are thinking about getting top surgery is during your consultation, your doctor is going to ask you questions about your eating, your smoking, and your drinking. You need to be as honest as possible, as well as your medications, so that the anesthesiologist can give you the correct dosage and make your surgery experience as safe as possible. That's all for today. I hope you liked the video. Please like and subscribe, and I'll catch you next time.